Most people think heart disease shows up suddenly, a chest pain out of nowhere, a trip to the emergency room, that one bad day that changes everything. But here's the thing. The real story isn't sudden at all. It's happening quietly, for decades, inside a place you can't see, can't feel, and won't notice until it's already gone too far. Let's talk about your arteries. Your arteries are the highways that carry oxygen-rich blood from your heart to every organ in your body. Your brain, your kidneys, your muscles, even your heart itself needs its own blood supply through vessels called coronary arteries. When those highways are open and flexible, everything downstream gets what it needs, when it needs it. But here's what happens with age, and honestly, with a lot of modern lifestyle habits too. The inner walls of your arteries slowly start accumulating something called plaque. It's a mix of cholesterol, fat, calcium, and inflammatory cells, and it builds up little by little, layer by layer, inside the artery wall. This process even has a name, atherosclerosis. Here's what makes this so sneaky. This buildup doesn't hurt. There's no nerve ending inside your artery wall screaming at you that something's wrong. You don't feel plaque forming. You just start noticing the downstream effects. Getting a little more winded walking up the stairs than you used to. Cold hands and feet because circulation isn't as strong. Brain fog in the afternoon because blood flow to your brain isn't what it once was. Slower recovery after exercise. Sound familiar? Most people chalk this up to just getting older. But a huge piece of it comes down to what's happening quietly inside those artery walls, years before anything shows up on a standard checkup. Okay, here's the good news. Your arteries are far more responsive to lifestyle and nutrition than most people realize, at almost any age. Ready? Let's get into it. The key concept here is something called the endothelium, the thin, single-cell layer lining the inside of every artery in your body. Think of it as the smart skin on the inside of a pipe. It's not just a passive lining. It actively controls how your blood vessels widen or narrow, and it plays a huge role in whether plaque forms in the first place. Here's the analogy I like to use. Picture a clean, smooth water pipe versus an old, corroded one. In the clean pipe, water flows freely, no resistance, no buildup. In the corroded one, gunk sticks to the rough inner walls over time, narrowing the space water can move through. Your healthy endothelium is like that smooth pipe. Once it gets damaged, it becomes rough, almost sticky, and that's exactly the kind of surface where plaque loves to accumulate. Here's the mechanism, step by step. When your endothelium gets damaged, usually from things like oxidized LDL cholesterol, high blood sugar, smoking, or chronic inflammation, your immune system sends white blood cells to the site to try to clean things up. Those white blood cells absorb the oxidized cholesterol and turn into something called foam cells. Foam cells accumulate, harden, and form the beginning of a plaque. Over years, that plaque can grow, narrowing the artery, and in some cases, becoming unstable enough to rupture, which is what triggers a heart attack or stroke. Now here's how this connects to aging specifically. As we get older, our endothelium naturally produces less nitric oxide, the molecule responsible for keeping vessels flexible and relaxed. Less nitric oxide, combined with more oxidative stress from free radicals, means more endothelial damage, more inflammation, and more opportunity for plaque to build. It's a slow, compounding process, which is exactly why prevention and reversal both work best when they're consistent, not occasional. This is where food as medicine comes in, because specific foods, with specific active compounds, have been shown to protect your endothelium, reduce oxidized LDL, and in some cases, even help stabilize or shrink existing plaque over time. Let's go through them. Number 1, oats. This one always surprises people because oatmeal seems almost too basic to matter. But the active compound here is called beta-glucan, a soluble fiber unique to oats and barley. Here's the mechanism. Beta-glucan forms a gel-like substance in your digestive tract that binds to bile acids, which are made from cholesterol. Your liver then has to pull more cholesterol out of your bloodstream to replace those lost bile acids, which lowers your circulating LDL cholesterol over time. Less LDL circulating means less raw material available to oxidize and damage your endothelium in the first place. Research has shown that consistent beta-glucan intake can lower LDL cholesterol by a measurable percentage over just a few weeks. The dose used in most studies is about 3 grams of beta-glucan daily, which is roughly 1.5 cups of cooked oatmeal. My tip: steel-cut or rolled oats have more intact beta-glucan than instant oatmeal packets, which are more processed. And skip the flavored packets loaded with sugar, since that works against everything you're trying to do here. Number 2. Fatty fish, like salmon. I love this one because it's genuinely enjoyable to eat, not just good for you in a boring way. The active compounds are omega-3 fatty acids, specifically EPA and DHA. Here's what they do. Omega-3s get incorporated directly into your cell membranes, including the membranes of endothelial cells, making them more flexible and less prone to the kind of stiffening that leads to plaque formation. They also reduce triglycerides, a type of fat in your blood that contributes to plaque, and they will have a genuine anti-inflammatory effect throughout your entire cardiovascular system. Research consistently shows that regular fatty fish consumption is associated with lower rates of cardiovascular events. The dose most commonly recommended is about 2 servings per week, roughly 3 to 4 ounces per serving, of fatty fish like salmon, mackerel, or sardines. Tip: wild-caught salmon tends to have a better omega-3 to omega-6 ratio than farmed, though both offer benefits. If fresh fish isn't practical, canned sardines or mackerel are a genuinely affordable, shelf-stable option. Number 3. Garlic. This one always gets attention because everyone's grandmother swore by it, and it turns out there's real science behind that. The active compound is allicin, which forms when raw garlic is crushed or chopped. Here's the mechanism. Allicin gets converted in your body into hydrogen sulfide, a gas that, similar to nitric oxide, helps relax and widen blood vessels. It also has direct antioxidant properties, reducing the oxidation of LDL cholesterol, which, remember, is the version of LDL that actually damages your endothelium. Studies have shown that regular garlic intake is associated with modest reductions in blood pressure and improvements in arterial flexibility. The dose studied is typically about 1 to 2 cloves of raw garlic daily, or if you're using aged garlic extract supplements, around 600 to 1200 milligrams. Tip: crush or chop garlic and let it sit for about 10 minutes before cooking. This gives the allicin-forming enzyme time to work before heat potentially deactivates it. Adding it toward the end of cooking, rather than the very beginning, also helps preserve more of the active compound. Number 4. Avocado. This one surprises people because it's high in fat, and a lot of us were taught for years that fat is the enemy. The active compound here is oleic acid, a monounsaturated fat, along with a mix of plant sterols. Here's what they do. Oleic acid has been shown to reduce oxidized LDL specifically, the damaging form we keep coming back to, while plant sterols compete with cholesterol for absorption in your gut, meaning less dietary cholesterol actually makes it into your bloodstream in the first place. Research has shown that regular avocado consumption is associated with improved cholesterol profiles, including higher HDL, the protective form of cholesterol. The dose used in studies is about 1 medium avocado daily, roughly half a cup. Tip: avocados ripen best at room temperature, and if you want to speed that up, put them in a paper bag with a banana. If yours is always going bad before you get to it, buy them a few days apart so you always have one at peak ripeness. Number 5. Walnuts. And I know we've mentioned nuts before, but they deserve a specific mention here, for heart health directly. The active compound is alpha-linolenic acid, a plant-based omega-3, combined with polyphenols unique to the walnut skin. Here's the mechanism. Alpha-linolenic acid gets partially converted into the same EPA and DHA we discussed with fish, supporting endothelial flexibility, while the polyphenols reduce oxidative stress directly at the artery wall. Clinical studies have shown that regular walnut consumption improves endothelial function and modestly lowers LDL cholesterol. The dose is about 1 ounce daily, roughly a quarter cup, or 14 walnut halves. Tip: don't peel the thin brown skin off the walnut. Most of the beneficial polyphenols are concentrated right there, so that bitter taste some people try to avoid is actually where a lot of the benefit lives. Now, if you're finding this helpful, this is exactly the kind of thing I dig into on this channel, breaking down the real mechanisms behind the foods people already have access to. So if you haven't already, go ahead and subscribe, because there's a lot more of this coming. Let's also talk about a few habits that work alongside these foods, because nutrition alone isn't the whole picture. Exercise matters enormously here. Even a brisk 30-minute walk 5 days a week creates something called shear stress on your artery walls. Basically, blood moving faster physically signals your endothelial cells to produce more nitric oxide, which we know helps keep vessels flexible and resistant to plaque buildup. Sleep matters too. Poor sleep has been linked in multiple studies to higher levels of inflammatory markers and worse cholesterol profiles over time. Aiming for 7 to 8 hours consistently isn't just about feeling rested. It's directly protective for your cardiovascular system. And stress management. Chronic stress raises cortisol, and elevated cortisol over long periods has been associated with higher blood pressure and increased visceral fat, both of which contribute to arterial damage over time. Let's talk timeline because I want to be honest with you here. Endothelial improvements from dietary changes can actually happen surprisingly fast. Some studies show measurable changes in blood flow within just a few weeks of consistent changes. But meaningful changes in plaque itself, if reversal is happening at all, typically take months to years of sustained effort and depend heavily on how advanced things already are, your genetics, and other health conditions. This isn't a substitute for medical care. If you have known heart disease, high cholesterol, or any cardiovascular risk factors, these foods and habits are meant to work alongside your doctor's guidance, not instead of it. Regular checkups, appropriate testing, and medication when necessary all still matter enormously. Let me answer a few common questions. First, can food alone unclog already formed plaque? The honest answer is, it's complicated. Some research suggests aggressive dietary changes, combined with medication in some cases, can help stabilize plaque and even modestly reduce it in some individuals, particularly when LDL is brought down significantly and kept low for a sustained period. But it's not a guarantee, and existing plaque, especially if calcified, is generally harder to reverse than to prevent in the first place. Second, do I need to avoid all fat? No. The type of fat matters far more than simply avoiding fat altogether. The monounsaturated and omega-3 fats we've discussed today are protective. It's the combination of excess refined carbohydrates, trans fats, and chronic inflammation that tends to be the bigger driver of harm. Third, how quickly will I notice a difference? Energy and circulation-related symptoms, like cold hands or afternoon fatigue, can sometimes improve within a few weeks of consistent changes. But cholesterol panels and any structural changes in your arteries take longer, usually several months, to show meaningful movement. So here's the bigger picture I want you to walk away with. This was never just about cholesterol numbers on a piece of paper. It's about a slow, quiet process happening inside your artery walls right now, whether you're paying attention to it or not. Oats, fatty fish, garlic, avocado, and walnuts each work on a different part of the same system, lowering oxidized LDL, supporting your endothelium, reducing inflammation, and helping keep your arteries flexible. Combine that with regular movement, good sleep, and stress management, and you're giving your cardiovascular system genuine support at the level where this all actually starts. If you want to go deeper, my next video breaks down the specific blood markers you should actually be asking your doctor to check, beyond just basic cholesterol, because there's a lot more information available than most people realize. Make sure you're subscribed so you don't miss it. I'll see you in the next one.